I'm Kathe Conner. I'm a nurse practitioner. I work here at the ASU Clinic, and I've been here for 14 years. Well, for a variety of reasons, because sometimes you don't feel sick, but you've got something going on. It's a good screening process. Most of us are very healthy, and as long as we don't have anybody in our family with a family history of diabetes or heart problems or like that, we're probably okay going every 2 years. But if you have family history of high cholesterol or diabetes or heart problems or cancer, you do need to be seen more often because sometimes the screening lab work that they do will pick up something. I usually tell people to talk to their friends. Who do their friends go to? Who do you see? How do you like them? What do they normally do? Type of thing. And then sometimes it's just pick and choose. You may go to one doctor and the first visit goes okay, but the next one's not quite so good, or you don't feel real comfortable with them your first visit. And you have to feel comfortable with them. You've got to be able to ask them questions and feel as though that you can ask them questions and you're going to get responses back. Women obviously are going to have the pap smears, which is the screening for cervical cancer. That starts at age 21, and they recommend that starting at age 21, every 2 years, girls get pap smears until about the age of 35. And then 35 and on, they recommend it every year. Women over 30 can go every 3 years if they've had 3 consecutive normal pap smears, which means they've not found any abnormal cells in when they do the pap smear. For men, they're going to start checking for testicular cancer is a disease that normally hits the college age boy. And then the prostate cancer is usually, you see that in the older men, they start checking that at age 50, doing that. Students are going to get not quite the detailed examination that the faculty and staff would get because of the age difference. Certain tests aren't recommended until they get to an older age, unless they have a family history of breast cancer or they have a family history of colorectal cancer. Then they're going to start testing a little earlier for those types of things. Well, they'll learn about their cholesterol. They have the lab work down for their cholesterol, and they'll learn if they're at risk for diabetes based on the lab work they've done. Also, the lab work will tell about whether or not their kidneys are functioning like they should be, whether they're anemic. If you take any medications, and when we say medications, we mean anything you take. Anything over the counter that you take, your multivitamins, your supplements that you take. If you are seeing this doctor for the first time and you have been prescribed medications from another doctor, you need to bring all of those in with you, or at least the list of them in with you. Family history is very important, so the first time you go to visit, they're going to ask you, they'll give you a form, and it's very important you fill that out and make sure that you include the family history of heart attacks or strokes or who has diabetes. You need to tell your doctor if you smoke. You need to tell your doctor. In fact, that's one of the questions that will be on your questionnaire for most likely. Do you smoke? If you smoke, how many packs a day? Do you smoke, or how many cigarettes do you smoke a day? And how many years have you smoked? Do you drink alcohol? They're going to want to know about that. They're going to ask, they may very well ask you how many sexual partners have you had. Those things are very important that you tell your doctor about, because that also is going to have an indication about what type of testing you need to be doing. We are guided by what's called HIPAA laws, which is the Health Information Portable Act, which means that we are not allowed to discuss your lab results with anyone. We can't even tell if you've been in the clinic. If somebody called the mothers. In fact, a lot of times we have parents call and want to know if their son or daughter came to the clinic. We can't tell them. We are allowed to share it with another physician. Let's say a student comes here and I need that student to go see an orthopedist, or I need them to see whatever. When I make the appointment, or when the secretaries make the appointment, that information can be shared with that provider. Most of the time a day, sometimes a couple of days, depending on the type of it. But most of the lab work, the screening type lab work, is usually back within a day. Pap smears take about a week to get the results back, and that depends on the lab. In fact, here the students can come in and get lab work done in the morning, and a lot of times we'll have that by the afternoon. Like if you were going to go see your doctor tomorrow for your yearly checkup, they might have you come in the day before and get what they call a fasting lab work, which means you haven't had anything to eat or drink since midnight. And then you go the next day and have your lab results so they can discuss on the future. Students only. We don't treat faculty or staff. At present, what we will do for faculty and staff is we'll check their blood pressure. We have some faculty that are on blood pressure medicines, and we're more than happy to check their blood pressure for them when they need it done. We provide flu vaccines every year for the faculty. We charge them $20, and we do encourage this faculty to come and get their flu vaccine. The ASU Clinic is located in the brick building next to the formal building that houses the parking. And so wherever you go get your parking tag, we're in the next building over to that. Our clinic hours are open Monday through Friday, 8 to 5, and Saturdays and Sundays, 1 to 5, and holidays are also 1 to 5. We are closed Christmas Day and Thanksgiving.